So the first question we have is, how quickly after being exposed to COVID will it show up for testing? If I was near someone today that has tested positive the previous day, will it show up immediately, or should I wait to be tested in order for it to be accurate?
Yes, so it's definitely, it varies. The same way as the information we have of how long after exposure somebody will develop symptoms. So it varies from those, 2 days to up to 14 days. And then some, very rare occasions, it takes longer for you to develop symptoms. And this is all connected to the number of viruses that replicate in your body. And basically you need that replication in order to, get a sufficient number of virus in order to get a positive test. So it will vary. Definitely, as soon as you get infected, it's not going to show positive. Will it show the next day? I would still say no. But the second day, I would already kind of, think that it's a very likely scenario that you would show sufficient number to test positive.
Okay, and then another question is Cornell Laboratory currently testing for COVID RNA? If so, or if not, can you give a recommended list of laboratories?
Yeah, so for Cornell, I definitely know that they are testing, because that's part of our plan of how to keep the students and faculty and staff safe. We established a big lab at our vet school where they have a big capacity, thousands and thousands of samples every day. So each student is tested twice a week. Staff and faculty are kind of divided based on how often they have to come to the campus. Some have to be, twice a week, some are weekly. Me personally, I have to do it every second week. So there's a lot of samples that are processed there. We are using, maybe it's not that uncommon when you have low, positivity rate in the community, to use something that's called pooling. So you take several samples from different individuals, you pool them into one sample, and you just test for RNA in that one sample. And then if that sample tests positive, then you go back to all the people that provided the sample for that one, and you test individually each of them. But yeah, Cornell is definitely testing. I don't know if there's a possibility of commercial testing. That's something I would have to get back to you. Other labs, and I know just for our Tompkins County, that Cayuga Health is doing a really good job at testing the rest of the community. And also I think the Cornell's positive results also go back to Cayuga Health for another testing to be confirmed before the positive result is actually recorded as positive.
And then a follow-up question for that question. Could these laboratories be used for environmental sampling?
Yeah, so there are private labs that offer environmental sampling. I think most of them are not the labs that would offer testing of employees. These are regular food labs that test for pathogens, quality parameters and stuff, and they added this COVID-19 testing of your environment, just because testing employees, so testing human subjects, it's not that straightforward. So you have to have a trained individual to take the samples. You have to have a medical doctor to oversee and actually order the testing to be done. So it's not that straightforward for regular lab tests, food lab tests to labs to perform the test. So yeah, again, you would have to talk to your lab if they are offering something like that or not.
All right, thank you. Another question, what information would you show people who know that are worried about catching COVID from their groceries, more from the packaging than the food itself, that the risk is minimal and they don't need to quarantine or disinfect their packaging, their food before bringing it into the house?
Yes. So first of all, even though it looks like, COVID is all around, the number of infected people is actually not that high. So when you enter a store, I did some like rough estimations, and in a regular grocery store, I think every day a single person walks in that's positive for COVID-19. So it's very rare that people that you interact in the grocery store actually are infected. That's one thing. And then another thing is that all people, we are all following the social distancing and the face coverings. So it's very unlikely that somebody, would come in and, basically spit around, on your food containers, especially now that we have the face coverings. Then even if that happened, even if there was like a major spit on that food packaging, because the virus is so sensitive, the number of viable viruses are, as soon as they exit the host, the numbers are going rapidly down. So basically, in order for you to get infected for something like that, you would really have to immediately, as that contamination happened, you would have to touch that surface. And even that, just touching that contaminated surface, that's not something that will infect you. The way you get infected is when you take that contamination, you bring it to your eyes, your nose, your mouth, because that's where the infection happens. So if you follow the face coverings, you're not touching your face, you are regularly washing your hands, using sanitizer, you're basically safe. So definitely, and then if you think about you're not food. So again, you're not eating the packaging, even if it is contaminated. By the time you take that food, bring it home, the time lapse is too long. The virus goes down rapidly. So still, when you come home, wash your hands. Wash your hands before you prepare the food. Wash your hands before you eat the food. So these are all kind of general food safety kind of steps that we were taking before COVID-19, and they work now as well. So definitely, you should not use any chemicals to disinfect. There is no need to disinfect your food, your produce, or the packaging when it comes to COVID-19. In fact, if you're doing that, you're actually putting yourself into higher risk because you're doing that. So if you look at statistics, the number of kind of chemical intoxications has gone up during this COVID-19 just because people are doing that. And imagine, so you experience intoxication, you have to go to the hospital because of that. And by being in the hospital, you elevate your risk of actually getting a COVID-19 just because you are in that environment. So by trying to minimize a really minimal risk, we scientists, it's impossible for us to say it is absolutely no way you can get infected from a contaminated surface. As we said, if somebody spits on your container, you immediately touch it, you immediately put it into your nose. Yeah, there is a chance you get infected. But all that, the risk is very low. And now with this low risk, you go and you use chemicals to sanitize, you get chemical intoxication, you go to a hospital, and all of a sudden your risk of getting infected with COVID-19 is up the roof. Instead of keeping that small risk that exists, you all of a sudden by doing this, you elevate your risk of not just chemical intoxication, but also COVID-19.
Thank you. So we have another question geared towards Cindy. Will New York State be looking for validation from manufacturing locations that the virus is not in the plant, or will the risk assessments and programs implemented be enough?
I'm not sure. I can answer that. Christine, you might be able to answer that question. I haven't.
Yeah, I don't think I can answer that question, but yeah, I don't know. I
haven't heard anything about that.
So I don't know if the question is directed, are you gonna look into are they testing environment for presence of the virus, or are they talking about presence within employees? So like screening and testing of your employees. In either case, yeah, I don't know what, like I said, like definitely testing your environment and surfaces for contamination with virus would not make sense. Just the virus is too sensitive, it activates. Even if you have any contaminated surfaces, the virus will not stay there for long. So if you have an infected person, employee in your facility, the risk is not to the food or the consumer. It's really just to those other employees that are there. So that's maybe what you have to do is have a good screening, measuring temperature, asking them questions, and really asking them, in a way that they will answer, if there's any doubt or symptoms that they will tell you. And then finally testing. Yeah, some sort of a testing is definitely recommended. And I don't know if that's something that Agri-Markets is enforcing in any way or recommending, but that's what it is. Yeah.
Okay, so we have another question. Would you recommend essential workers quarantine at home if they have been in contact with a positive case or are under quarantine orders but allowed to work? What about travelers to states with a high transmission rate?
Yeah, so that's actually what we talked about. It's all about the risk, So if you have a person that was in close contact with a positive person, definitely I would send them home and wait those 14 days if you can work without them. But during those crises, you just couldn't afford, for example, having a manager that's running the production. There are just some roles that you need to keep, and in that, like I said, CDC is, FDA are allowing, if you had a close contact, they said that just have them on a more strict screening, following if there are any symptoms developing. But again, guidelines are just guidelines, so you have to talk to your local health department, your Agri-Markets, to see if that's actually allowed. So whenever you have doubt about any positive people, about close contacts, yeah, talk to your health department, talk to your Agri-Markets about what do they think. It's very case to case, I think.
And then I have another question. In laboratories, frequently sanitized surfaces may not be sanitized as frequently as, say, in a processing facility, and are not done routinely. What do you recommend for those types of facilities, like a laboratory that's a commercial laboratory?
Yeah. So it all comes down to the risk. So now we know, and you can see, CDC guidelines, FDA guidelines, the risk of getting infected from contaminated surfaces is very, very low. We still recommend, for those frequently touched surfaces, so surfaces that a lot of people in short amount of time are touching. On one side you have a lot of people touching, and then on the other it's very, frequent. So it's one after another, So when we talked about somebody contaminating on surface, in order to get infected, you would really have to immediately, touch that surface in order to pick it up. So we're still saying that you should work on frequently touched surfaces, but the risk compared to person transmission is not even comparable. So the first thing you should do is have good education for your people to know that they have responsibility to stay safe outside of the work environment. And then when they come in, it's the key is to establish that 6 feet distance, to have those face coverings, to not touch your face, and to wash your hands. These are really the most important parts. And contaminated surfaces are much further from that.
So in our laboratory, we always would decontaminate our workspace before and after we used it. Since we're dealing with microbes, we would wipe down all of our pipetters and such. So the only real difference that we have in our lab is our OGS is coming in and doing the door handles that we, the door handles in and out of the laboratory and actually in the whole building. But there some spaces that we didn't traditionally wipe down are like areas like Al said that everyone uses, like for when we're receiving samples, there's one computer that everyone would use. So we're wiping down that keyboard before and after use like we would in the laboratory. But that's really the only change that we've made right now.
Maybe with surfaces, I would just emphasize something that's maybe a bit higher risk is, like phones, whatever, microphones and stuff that's really close to your mouth. That's maybe a bit higher risk. So if you have something like that, it's basically good to have a personalized microphone, earpieces and stuff like that. And also be careful how you're using, the phones and stuff like that.
Okay, so then I have another question. Can an employer require COVID testing to be done on a symptomatic person in order to return to work? What have you seen?
Can you repeat the question? I think there was a bit of a break. So a person is symptomatic and then the employer asks for a test, is that?
Yes, can the employer require a test be done in order for them to return to work?
Oh, so that's, okay, so is that, so one part would be they have a employee in the facility that shows symptoms, and then should they send them to get tested? Just by, I think, contacting your medical provider or Department of Health, I think the next step either of them would say is to get tested. So I think that would be a natural step. Now, if the test comes back negative, yeah, I guess some other diagnosis would have to come about, and they're positive. But in either case, whatever symptoms are there, even before the COVID-19, when employees develop any kind of symptoms, we were always advised to keep them at home. Here, yeah, I would do the same. Yeah, if they just develop the symptoms, I would send them home and send them to get tested. Now, the other thing is once they, if they are positive or they are diagnosed with COVID-19 and they stay home, if the question is, can they be tested, and then come home, come to work if the test is negative? Sure, you can always do that. I think you have to have 2 negative tests 24 hours apart, and then you can come to work before those 10 days. But testing is not, once you are diagnosed, the testing is not recommended. What's recommended is just to stay isolated for 10 days, and then you can return to work. maybe I can add an interesting part is that if you had a contact with a positive individual, and that's maybe a bit sometimes confusing for some people, if you had a contact with positive person, then it's recommended for you to stay home for 14 days. While when you're already showing symptoms and you're diagnosed with COVID-19, you're required to stay at home 10 days. The recommendation is to stay 10 days, which is kind of, to some people, it doesn't make sense. But the thing is, you know, based on the results, and there's a massive body of evidence, you know, it takes 2 to 14 days for a, you know, infected person to develop symptoms. But once they develop symptoms, it takes them up to 10 days to clear the virus and stop shedding infectious virus. So they stop being infectious and a risk to other people, and that's when they can return. So that's where the 10 days are coming from when you refer to the viable virus. Still, when you're testing, you know, that's maybe another thing why the testing is not recommended, because as I said, the RNA can remain in your body and could be detected for up to 90 days, you know, after the symptoms develop. So even if you test, you know, after whatever, 20 days, and that result is positive, it's just positive for that RNA, and you're probably not shedding the virus past those 10 days after the symptoms develop.
Okay, so another question. Did your laboratory implement any extra PPE or cleaning because of COVID-19? Are you requiring masks to be worn in the laboratory?
I don't know. I mean, I know the lab I'm working at in the milk quality improvement program. Yeah, we are definitely following everything. The social distancing. There's, you know, just certain amount of people, one person per bench. Every second bench is free, and yeah, face coverings are worn at all times.
We're wearing our face coverings in the lab as well. Social distancing, the whole.
Yeah.
Yeah.
There are some labs that recommend once you are at your workstation. So, you know, the workstation is definitely more than 6 feet away from everybody, that you, at that point, you can take the face covering off. Just because, you know, if you're working with fire and those synthetic masks, sometimes, you know, that it can also maybe present a risk of burns and catching fire.
So another question, when COVID first started, and it's still going this way for some people were put as essential, some were not. How do you keep your morale up for those folks that did have to still continue to report to a location for work and were not able to work from home?
Yeah, I think that's a story of entire, you know, food industry, you know, being essential. You know, the nation has to eat, so we have to make food. So everybody was for it. So I think a big part of what, you know, why we established this and how we actually help with this COVID-19 task force. So we developed a web page, but we also started immediately having once or twice a week this office hours. So an hour when anybody, you know, from industry or consumers can call in and have questions. And I think we definitely, you know, and you know, New York was hit the hardest at the beginning. And I think that was really helpful for the general public, you know, to call in and basically, you know, you give them straight answers about, you know, the risk. So at the beginning, it was all mayhem, you know, everybody's infectious, you know, the risk is all around. But basically, you know, once we established, you know, that, you know, surfaces, contaminated food, these are not the risk. It's really person to person, and establishing that the virus outside of the host is so sensitive, you know. So it's basically just that, yeah, addressing, asking. So what is your concern about coming to work? You know, oh, I'm afraid that, you know, people will infect me. Well, you know, we're doing this, you know, we're doing social distancing. You explain where the social distancing is coming from. We're wearing face coverings, you know, why are we doing this? We're doing screening, you know. So explaining really how, you know, all the multiple levels of how they are protected. So I think that's the only way, is being honest and addressing the specific issues that they have. I don't know, Christina, if you have any insight on that, maybe you have more information from the field.
So our lab didn't close at all when it first started. We were deemed essential, so we continued to come to work as we always had. One of the things we did, because you know the rest of the United States was going to work in their pajamas because everyone was staying home, we actually implemented a pajama day here, so that if you're, you know, it had to meet all of the, you know, requirements of our hygiene plan, our chemical hygiene plan and biosafety manual. But if it met those requirements, then you could wear your pajamas to work. So it was one of those ways that we sort of, you know, our employees were stressed like everybody else, and they still had to get up and go to work. And it was just a way that we couldn't, like, our traditional way would have been to everyone get together and we'd have like donuts or cake or whatever, but we couldn't do that. So that was just an idea that we came up with, so that the people that we knew were making the sacrifice, that we could sort of reward them, and just that's what we did. I don't know if there's anyone out there that has other labs that, I mean, what did you guys do? I mean, I think talking about I think like Al said, talking about you know, what the issues are and how people were feeling and how they were handling it is, you know, one of the best ways to deal with it.
So basically, kind of going off of that question, if you had an employee that was deemed high risk, would you handle that any differently than what you've already spoke upon, or would that go into the same type of category of how you handled everyone?
Yeah, so I mentioned,
go
so
ahead.
if you have are you Cindy? Yeah, go ahead, please.
No, you go ahead.
Yeah, so so I talked about people that are of higher risk of developing a severe illness. So, you know, all elderly, immunocompromised, or in any way, you know, so people on medications and stuff like that. So if you have people like that working in your environment, then yeah, definitely it's something to think about. Where, you know, how are they going to work? What is the position? And maybe, you know, people that are actually interacting with them, maybe you can put them on a bit enhanced kind of screening, testing, maybe introducing that to them, that basically, you know, if they are not, you know, that they do represent a higher risk for this person. If they do get sick, you know, they can develop harder. So definitely I would tailor your screening methods and just how you approach it if you have a person that's higher risk. But then again, you can also think about it. Do you need that person in, or is there any chance of having them, you know, working remotely? Are there any tasks that they can work remotely, or is there a task that they can be, you know, isolated from the rest of the people, and so on and so on. So yeah, it's all case by case. It's hard to say.
Yeah, in our lab, we didn't have anyone that actually fell into that category, but we did have people that were living with people that would fall into that category. And we also had other staff members whose partners were paramedics and first responders. So we, again, there was a lot of stress about that. Like, you know, if your lab employee was going home to a first responder who could have been exposed and then bringing it into the lab. So what we tried to do is really early on, very, very early on, is follow those strict social distancing rules, and just to make sure that everyone was comfortable in their workspace, so that, and like Al said, we tried to separate those people that, you know, had that little bit of a higher risk to do things that that maybe they could do on their own, like in a different room or, you know, away from the rest of the staff, just so they would feel more comfortable about coming to work and everything that was going on. But it was a logistic nightmare, not gonna lie.
All right,
Hi,
so
oh, sorry, Christina. This is
go
Barb.
right,
So
go right ahead, Barb.
my husband works in a lab in industry, and we have a high-risk individual in our home. And to Cynthia's point, the plant was very good about making sure that he was as far away from other employees as possible, and you know, the social distancing, the face mask wearing and stuff. So I do think it's important to note that industry has responded quickly to individual employees' situations and trying to help their employees feel safe so that we can continue putting out the food, because to Al's point, America still needs to eat. So I do think that the labs have done a really good job of trying to protect their workers and get the testing still done in a timely fashion.
All right, so another question, and I think everybody has seen this at some point of just their day-to-day activities. Did you find it difficult finding supplies, disinfectant, cleaning solutions, PPE? How did you handle that? And then to elaborate on that, are you now finding it hard to find supplies you need to perform activities in the laboratory?
Yeah. So maybe somebody else is more, because I'm actually not so much in the lab since this started, or actually in general from January when I started working as extension associate. But yeah, definitely everybody felt like, you know, the shortage of supplies. Definitely, we all know hand sanitizers. That's one of the kind of initiatives that we did is trying to supply more hand sanitizer. So there was a number of different like food processing facilities, like, you know, breweries, distilleries, that, you know, they were able to manufacture like additional hand sanitizer. So that was one part of how to kind of resolve that issue. Definitely the face coverings, the whole cloth face coverings came out because there were no supplies. So, you know, what's the next best thing? So that's why we come up with, you know, face coverings, of making them reusable, washing them. Now, I think the supply of surgical masks is pretty good. And I think everybody was able to stock up on supplies. I think I heard some information that we have, for example, stock for 3 months to kind of to be able, you know, if the supply stopped now, we would be able to work for 3 months without a problem. So I don't know if anybody else has any experience of that, but definitely, yeah, there was a shortage.
So in our lab, we had obviously had a little bit of supply of our disinfectant. We never had a problem with that, but we do use our Clorox wipes on our pipettes and stuff that we don't necessarily want to douse in bleach all the time. So we had an order in that came in, but then our next order hasn't come in yet. So that was back in March. So we've definitely seen a shortage of those. For the hand sanitizer, since we're a state lab, we got the prison-made stuff pretty quickly. That came really, actually, the governor announced that they were making it, and we got it like the next day. It was pretty fast. As for the face coverings, we had a supply of those as well. I think, and like Al said, now there's just a plethora of them. They're everywhere. So in the beginning, it was tough. We're still fighting to get some supplies, not necessarily disinfectant, but the hand wipes or the Clorox wipes are something that we're still looking for on a regular basis.
Okay, so another question. Did you have any employees who were or not that, sorry. What did you do when you had an employee that tested positive, if you had? If you hadn't, what is your plan if you did have a positive employee?
So for us, we are following the state. We haven't had an employee test positive. We've had a couple employees who, like I said, there are one staff member whose significant other is a paramedic. He very early on transported an elderly patient that later test positive for COVID. At the time, they weren't wearing masks because I couldn't find any. So she was quarantined for the 14 days. If we had a positive staff member that test positive, they would follow the CDC recommendations. If they've got symptoms, then it's going to be 10 days. If they're symptom free, then it's going to be 14 days. And there would be an extra sort of scrubbing of their work area, any work areas that they had been in, we would go in and disinfect. That's our plan right now. Knock on wood, we haven't had to implement it yet. Me knocking on wood.
So basically all the preventive strategies are, if you think about it, they're all in place, and we are all acting as if everybody is infected. You know, we're constantly keeping 6 feet away. We're constantly wearing face coverings. We're not touching our face. We're washing our hands, using sanitizer. So we're constantly behaving as everybody is infected. So if a person, you know, turns out to develop symptoms or, you know, test positive, then, you know, they have to go out of the lab, go out of the facility, you know, move away from everybody as soon as possible, go home. We recommend to, you know, you call your Department of Health, you call your health provider, and that's it. Yeah. If, you know, if you can think, you know, and then, yeah, you think about, you know, what are the surfaces where this person worked? You can, you know, disinfect those surfaces. And then the general, you know, contact tracing, you know, talking, seeing, you know, who this person was in contact. But in general, you know, if everything is right, they should all keep away 6 feet, wear face coverings, and that's it. But, you know, the general contact tracing, as, you know, the CDC has guidelines on that, is performed. And that's it, yeah.
All right, thank you. I have another, and it may be our last question, unless we get more in the chat. Have you made any permanent changes due to the pandemic? So people that are now remote, working from home permanently, or shift changes, anything like that?
I don't know from a lab perspective. I would say people still have to go into the lab to perform the lab tests, but just in general, like working environment, I think, yeah, it's definitely a shift in how we think things can be done. Like, you know, I'm pretty sure everybody is really like positively surprised how well things can work. You know, we do get a lot of work done from home, you know, if we don't have to go in. So I think there's definitely going to be a shift in how we work. What are the things we can work from home and so on. So maybe that's going to be, you know, a leverage for some people after this COVID is over, to convince their boss that, you know, maybe 3 times a week they can work from home. Yeah, I don't know, Cynthia, if you have any comments on that.
Yeah, I would like Al, when you work in a lab, it's kind of hard to work from home when you have to do lab tests. So we haven't really made, as far as shifts and hours that people come in, haven't really made any changes to that because of when the samples come and all their rules and regulations about when they have to be analyzed. So right now, everyone's on the same schedule. Everyone has to come in every day since, again, we work in a lab. But like Al said, I can see in the future where a lot of our, a lot of people do get to stay home and work from home. We'll have more pajama days.
Yeah, I think a lot of it, is somebody on the line? Yeah, I think a lot of it will come down to, you know, the relationships that we build, you know, kind of not, I think what we learn is like, maybe we taken like food employees as kind of granted, you know, so maybe now we're going to put more effort into, you know, building those relationships and having people that actually, you know, are there to step on the line and help us out when a crisis occurs.
Right, I agree. I think it could be a good thing for all of those, you know, food workers to be recognized for the essential workers that they are.
Yeah.
All right. Well, thank you so much for joining us and answering all of our questions that we've had today.